Hello everyone and welcome back to our channel, and today our topic of discussion is ulnar nerve. Ulnar nerve is also known as magician's nerve because of its ability to control the fine movements of the finger. And if we talk about the root values of ulnar nerve, then C8 and T1 are the root values of ulnar nerve. Here this diagram represents the anterior view of right upper extremity, and that yellow shades represents the course of ulnar nerve, and that one is brachial plexus, and that blue shade represents the articular surfaces, tendons, flexor retinaculum or ligaments, and this red shape represents the belly of muscles. In this video we will discuss about the course, relations and the branches of ulnar nerve. Ulnar nerve originates from the medial cord of brachial plexus. That one is the brachial plexus. It takes origin from here, and it runs medially along the upper half of arm, and it runs posterior-medially in lower half of the arm, and it lies behind the medial epicondyle, or you can say it runs posteriorly to the medial epicondyle and then enters into forearm by passing between the two heads of flexor carpi ulnaris. That one is humeral head and that one is ulnar head. And in the forearm it runs along the lateral margins of flexor carpi ulnaris, and almost in the mid forearm it gives two cutaneous branches. One is the palmar cutaneous branch, and the second one is dorsal cutaneous branch. Then it goes downwards. It passes superficially to the flexor retinaculum and just covered by volar carpal ligament. So this is volar carpal ligament. Now ulnar nerve entered into palmar region, and it divides into two terminal ends. First we have is the superficial terminal end, which gives sensory supply to the fourth and fifth digits, and second we have is a deeper terminal end, which gives motor supply to the lateral aspect of palm. Now I am going to show you the surface anatomical representation of lower end branches. So first I'm going to talk about the superficial end branch. So it gives sensory supply to the medial aspect of ring finger and complete little finger. And if we talk about the deep branch, then it moves laterally along the deeper palmar arch. So this must be the approximate surface marking of deep palmar arch. Now here it gives motor supply to the interosseous and lumbricals and the thinner muscles. Till here we are done with the courses and relations, and now we will discuss about branches of ulnar nerve. So in the arm it does not give any branch, and in the forearm it gives motor supply to the flexor carpi ulnaris, and here it also gives motor supply to the medial fibers of flexor digitorum profundus, and almost in the mid of forearm it gives origin to the palmar cutaneous branch, and just below this, just 7.5 centimeter above the wrist, it also gives origin to the dorsal cutaneous branch. It gives cutaneous supply to the proximal part of medial 2.5 digits. And if we talk about palmar cutaneous branch, then it gives cutaneous supply to the skin over hypothenar eminence. And at the lower end of forearm, ulnar nerve also gives articular branch for the wrist joint. After that, the nerve has entered into the palm, and its superficial terminal branch gives motor supply to the palmaris brevis muscle, and it gives sensory supply to the medial 1.5 digits. So the superficial terminal branch gives supply to the little finger and the medial aspect of ring finger. And if we talk about the deep terminal branch, then first it gives motor supply to this muscle, that is abductor digiti minimi, and then it runs laterally along the deeper palmar arch, and it gives branches to the lumbricals of 4th and 5th digits, and then it runs laterally and gives branches to the dorsal and palmar interossei. So basically it gives branches to all of the 8 interosseous muscles, and then it runs more laterally and then gives supply to the adductor pollicis, and then finally it ends and gives final supply to the flexor pollicis brevis.